Have you ever wondered why some of us get extremely grumpy or complain of having severe headaches when we miss our morning coffee? Or have you come across a friend or a colleague who cannot imagine surviving, back to back meetings, paperwork, or completing an important project without consuming several cups of coffee? Well, in that case, your friend or colleague, or maybe you, are experiencing something what we clinicians call caffeine withdrawal symptoms. Hi everybody, I'm Diya. I'm co-founder at Psychonnect, and in today's video on 29th World Mental Health Day, I will be discussing some of the signs and symptoms of caffeine withdrawal disorder to help you understand what it looks like and how can you better manage or control its symptoms. So, it's important to understand that this caffeine withdrawal disorder is recently recognized and added to the DSM-5 list. And if you or you know someone who is a daily and prolonged user of caffeine and have decided to cut caffeine from their life forever, they might experience this withdrawal symptoms. So how do you understand that you are experiencing these withdrawal symptoms? I'm going to point out the list for you here now. Now, first thing, when you drastically want to cut down your caffeine intake, you will suffer from headache, and I mean severe headaches, throbbing pain. Sometimes it might look like you're having migraine headaches, but that's the hallmark feature of caffeine withdrawal symptom. The second thing is you will be suffering from some disruptive mood or irritability and even negative mood. You will feel like you don't want to do anything. You might even feel like you're not enjoying the things you used to enjoy before. So it can be quite a difficult thing for anybody when you're feeling low and you're not able to even concentrate on the things you used to enjoy before. Then we have mental fogginess or brain fog, where a lot of people, when they're experiencing these withdrawal symptoms, they feel like their brain is not effective, their judgment or their problem solving or decision making skills are impaired. Then there is also something like a lot of people complain about is feeling extremely tired or even drowsy, lightheaded. Although fainting is quite uncommon, but it is advisable that you don't push yourself to do some hard or physical task. If you're feeling dizzy, maybe grab a chair and sit down, drink some water, and then probably get up and get going. But don't push yourself if you're feeling dizzy. Then there is also certain people complain of experiencing psychological craving for coffee, because your body is used to certain amount of coffee and you're depriving your body from that. For some people, even their appetite increases, which gets even more difficult to get through this phase. And most importantly, some people also experience some physical flu-like symptoms, like they might experience muscle stiffness, pain, nausea, vomiting. So the bottom line is, it is extremely unpleasant feeling. It can be psychologically, emotionally very challenging to deal with, and it can even impair your social, occupational and other avenues of life. So what to do when you're experiencing these symptoms? Well, if we go by some of the tested and tried clinical interventions, I think brief cognitive behavior therapy is most effective. Recently, Johns Hopkins Medicine published a paper indicating that it can be quite effective. Then there is yoga and simple breathing exercises, which you can try to keep yourself calm, composed, relaxed, and keep your mind distracted from any sorts of caffeine intake. Also, skillful compassion meditation is very powerful, not only for dealing with this condition but any sorts of addiction control. Then you can also uh, try out behavior modification tailored with positive reinforcement. There have been quite a few research published saying that when clinicians have strategically taught their patients to find out the triggers or find out the time or um, the the days or situations or events which trigger them to have coffee, if they can monitor that and they can set some positive goals or reinforcements to prevent themselves from consuming large cups of coffee, that can be quite useful. But apart from that, you can also apply some self-help techniques, for example using alternative drinks or substituting caffeine with something which is more healthy like tea or maybe decaf. Also remember, it's important to understand that in whatever method you apply, you have to take a gradual and staged withdrawal approach. If you try to cut out caffeine intake drastically, you are bound to experience this withdrawal symptom. So it's advisable, whatever you do, you take a gradual approach, you be